This Good Morning Washington Spotlight on Your Health is sponsored by George Washington University Hospital.
We're turning the spotlight on your health today, and joining us is Dr. Sama Nassereddine. She is an assistant professor of medicine in the Division of Hematology and Oncology at the George Washington University Cancer Center. First of all, welcome to the program.
Thank you.
Let's talk today about leukemia awareness. And first off, what is leukemia?
Yeah, leukemia is a cancer of the white blood cells. It affects the bone marrow. That's where all the blood cells are being produced. And for some errors, leukemia happens.
Now, is there a way for a person to know they potentially have it? Or how do you, as a doctor, look for signs to maybe test a person?
Very good question. Often leukemia sparks fear among patients, but leukemia is not one disease. You have some patients who they found out about it during a routine visit to their primary care doctor, and their blood counts are abnormal. They are referred for hematology. And some more aggressive forms, patients will actually present to emergency room with severe fatigue, short of breath, lightheadedness due to anemia, bleeding tendency, fever, and chills. And we always talk about the B symptoms, which are weight loss, unintentional weight loss, fever, chills, and night sweats, often are present in leukemia, as well as bone pain.
Wow. So the key, it can present a lot of different ways. So the bottom line is, anytime you have any symptoms for anything, I guess you always start with the doctor.
Yes, that's a good start.
What is then the treatment? You said there are different kinds. Are there different types of treatment?
Yes, we will talk about how we diagnose it, because that will lead into the treatment decision. Typically, the diagnosis is based on a blood work, and that will tell us that the patient has leukemia. And then we also ask for a bone marrow biopsy that will help us understand more the disease. And what I want to highlight here and acknowledge the advancement in the field for the past decade, where we unraveled a lot of the genetic alteration that's responsible for leukemia formation. And this is not only important for diagnostic purposes, to make a diagnosis and tell the patient about their prognosis, but also for treatment decisions.
Wow. So there's been a lot of advancement, is what we're saying.
That's true. And it's an exciting time to be in the field of leukemia.
So then what happens next? You get these details. What are the steps you take to help treat it?
Yeah. When we say cancer, we say chemotherapy. So as I said, leukemia is several subtypes. Some patients who are asymptomatic, we may not need to treat them, and that's the case that applies for patients with chronic lymphocytic leukemia. And then you have the chronic myeloid leukemia, where we can also tackle them with targeted therapy, which is an oral pill that's quite effective and well tolerated. In acute leukemia, the backbone remains chemotherapy, but the advancement has been in the targeted therapy with precision medicine. So we tailor the treatment depending on the genetic alterations we see.
Wow. So very specific to each patient.
That's very true.
Let's talk about support and resources available to patients that do have leukemia.
Yeah, so as you can tell, it's a very, it's a high burden disease, and it takes a lot of mental pressure on the patients. So at GW, we take a holistic approach to our patients. And I always say, we do not treat the disease, we treat the patient. So it's very important to have a multidisciplinary approach to our patient, make sure they understand what they are going through, because information is power, and we want empowered patients to make the best decision. We have a great team of palliative care doctors who support their patients through their symptoms, pain management, and we do connect them with the right mental health resource support.
Before we go, is there anything else our viewers should know?
Yeah, blood cancer is rare, but we have to remember that every 3 minutes, a patient is being diagnosed with either leukemia, lymphoma, or multiple myeloma. At GW Hospital, we are ready to see them if they need us to.
All right. A lot of great information. Dr. Nassereddine, thank you so much for spending some time with us here this morning.
Thank you.